The third category of drug are ulcer protective drugs, which form a coating over the ulcer and protect it from irritation by acid. For example, sucralfate, colloidal bismuth, subcitrate, earlier bismuth salicylate was also used. And the third one is prostaglandin analogs. Prostaglandin analogs have dual action. They reduce the production of acid as well as have a ulceroprotective action also. The prostaglandin analog we use is misoprostol. And the last one is anti-H. pylori agents, which are antibiotics such as clarithromycin, amoxicillin, tetracycline, and metronidazole. Now let's first discuss the drugs which reduce acid secretion, which are anticholinergic, H2 blockers, and proton pump inhibitors. So let's discuss these drugs. H2 block, first anticholinergic. Then H2 blocker and proton pump inhibitors. Anticholinergics are pyrenzepine, telenzepine, H2 blockers are cimetidine, ranitidine, famotidine, nizatidine, and roxatidine. Proton pump inhibitors are omeprazole, esomeprazole, lansoprazole, dex, lansoprazole, rabeprazole, and pantoprazole. So these are the name of the drugs: anticholinergic, pyrenzepine, telenzepine, H2 blockers, cimetidine, ranitidine, famotidine, nizatidine, roxatidine, and proton pump inhibitors. omeprazole, esomeprazole, lansoprazole, dexlansoprazole, rabeprazole, and pantoprazole. Now these anticholinergics are not used anymore. Why? Because there are three types of acid secretion. One is nocturnal, which is produced at night. Second is basal, which is produced throughout the day. And the third is meal induced, which is produced in response to meals. Now these anticholinergics suppress around 50% of acid secretion, but they suppress only meal induced acid secretion, not the basal and nocturnal one. Only meal induced acid secretion is produced, not the basal and nocturnal one. So these drugs were not that effective and they are not used anymore. Now H2 blockers, they suppress around 70% acid secretion. And they suppress nocturnal, basal and male induced, all types of acid secretion. But the problem with them is nocturnal and basal secretion, they suppress almost completely because they are mainly under the control of histamine. But this meal induced acid secretion is also under control of other factors such as acetylcholine and gastrin. So they do not suppress meal induced completely. So they do not suppress meal induced acid secretion completely. So H2 blockers are used. They were the main drugs between 1970s to 1990s. But at the time of 1990s, proton pump inhibitor was discovered. So from 1990, slowly the use of proton pump inhibitors has been increasing, and they are the drug of choice for most indications as they are more effective in suppressing acid secretion. They suppress all three types of acid secretion: meal induced, nocturnal and basal, and they are about 90 to 98% effective in suppressing the acid secretion. They are so effective because they inhibit H plus K plus ATPase pump, which is the common final step in production of acid. So first we will discuss H2 blockers. In H2 blockers, the first one which was discovered was cimetidine. But cimetidine had certain disadvantages. Now, what are H2 blockers? They are competitive inhibitors of H2 receptor. So histamine is not able to act. Most are competitive except only one exception over here, famotidine, which is partly competitive, partly non-competitive. there are various disadvantages of cimetidine. The first disadvantage is it is short acting. Secondly, it is less potent. Thirdly, it is an enzyme inhibitor of CYP enzymes. So it can increase, it inhibits various CYP enzymes such as CYP3A4, CYP2C1, etc. It can increase the concentration of drugs which are metabolized through those enzymes. For example, carbamazepine, warfarin, etc. And it can cause toxicity of those drugs. Fourthly, it has certain anti-androgenic side effects, such as it displaces testosterone from its binding site. Increases metabolism of estradiol and increases prolactin secretion. So it can cause side effects such as gynecomastia, impotence, galactoria. Now, other drugs which can cause gynecomastia can be remembered by a mnemonic DISCO. So DI is for digoxin, S is for spironolactone, and C is for cimetidine. So these are the drugs which are responsible for gynecomastia. Now after cimetidine, the next drug which came in H2 blockers was ranitidine. Now ranitidine do not have these side effects, these anti-anabolic side effects, and it is more potent than cimetidine. So it was a very commonly used drug at that time. Now famotidine is the most potent H2 blocker. Now what are the uses of these drugs? So it can be used for peptic ulcer disease, it can be used for GERD or gastroesophageal reflux disease, where lower esophageal sphincter is incompetent and there is reflux of gastric contents into the stomach, into the esophagus, and this can lead to, the complications can be erosive esophagitis, that is there is inflammation in the esophagus. There can be metaplasia, that is change in lining of squamous lining of esophagus to columnar. So intestinal metaplasia can occur, and it can lead to perforation also. It can also lead to formation of stricture in esophagus. So these are the complications of GERD. So it can be used for GERD and its complications. The third use is stress ulcers.